Thanks for listening to today's episode of the Wayne County Chambers podcast, For the Record. We want to say a special thank you to our sponsors, Sport Durst of Goldsboro, Goldsboro Builders Supply, and Professional Data Management. The Sport Durst team is ready to get you into a beautiful new Volkswagen. Offering open and honest pricing on every vehicle and service, Sport Durst of Goldsboro understands the value of your time and dollars. Providing quality building materials since 1953, Goldsboro Builders Supply is your premier destination for custom designs and excellent service to builders and contractors in Wayne County and surrounding areas. Professional Data Management offers specialized service and technologies designed to help you gain maximum reimbursements for the valuable services that your office provides. Another huge thank you to our in-kind sponsors, Daniels Furniture, University Lights of Goldsboro, and Johnson Carpet One, who together worked hard to make our beautiful podcast set what you see today. And for the record, we're glad you're here.
How are you?
Great.
It's good to see you.
Great.
Thanks for joining us. You guys have some name badges on. That's official.
Absolutely.
Yes.
Well, that's a part of the identification in the hospital, so everyone knows who works there. So,
okay. Yeah. So now tell us who you are, your name, who you work for, and your role there. And then we'll get into maybe how you got to where you are. Does that work?
Sure.
Yeah.
Absolutely.
Tell us about yourself. Yeah, you go ahead.
Yes, actually, I work for the community. So I work for our patients and those that seek care, but I'm employed by UNC Health Wayne, okay. Which many people call Wayne Memorial Hospital, which includes our foundation and our watch program and a couple of other entities. But I've been there for about 3.25 years, and I've been in healthcare for over 3 decades. Started off as a pharmacy technician at Eckerd Drug Store. Oh, wow. But we were called drug clerks back then. So my wife and I met, and so we've been married for nearly that long. And actually almost 34 years. And so after my 4 years of college, I was doing that while I was in college. I was, of course, an ROTC, got commissioned as a second lieutenant in the Army as a medical service corps officer, ran hospitals all over the country and across the pond as well. Did one combat tour in Iraq during my time, retired back in 2009 at Fort Liberty, and then began running hospitals in Texas, New Jersey, and Memphis, Tennessee, and then I've been here 3.25 years.
And what is your job? Just so we're clear.
Oh, the president and CEO of the hospital.
Man, that's official. Is what I heard. That's what I heard. I don't know. Well, it's not just president; it's president and CEO.
Yeah, doesn't get more official than that.
Do you know what this name tag means? That's what you could do that.
No.
That's exciting.
No, I'm a member of the team.
That's cool. Yes. That's cool.
Oh, yes.
All right. So where are you from originally?
Well, I say I'm from Columbia, South Carolina, but my dad was in the Army, and so was my grandfather. So I'm third generation, and my dad retired at Fort Jackson. And so I went to college in Columbia and probably high school in Columbia, but before that, all over the world.
Okay.
From Alaska to you name it, wherever my dad was stationed, that's where we went.
Very cool. Okay. Very good.
So I'm Kimberly Fazio. I am the Director of Marketing and Communications at the hospital at UNC Health Wayne. I've been there for 6 years. I've worked in healthcare pretty much my whole career in various capacities. And I've held some different roles at the hospital, but have always had some hand in our marketing and communications.
Very good.
Yeah.
Marketing. She's very modest, by the way.
She's very modest.
Exceptional work. Yeah.
Thank you.
Absolutely.
She does a lot of things.
Yes.
She does a lot of different things. It says marketing. It says marketing, but then there's other stuff.
Yes.
It's like marketing plus some other stuff.
All of the things.
All of the things.
Put glue in there somewhere. Yes. Holds it all together. Yes.
That's very good. Oh, yes. Well, thank you all for sitting down with us. I think there's a handful of things I'm so excited to talk with you about because healthcare is such an interesting subject. And there's so many directions to go. We won't be able to cover all that ground, but I guess I wanted to start with thinking about rural healthcare. Because just like everything else, it seems like there's a difference, if you're in the city or if you're not. And I would think it's no different for healthcare. It's a different environment, probably a whole different set of challenges, or I'm sure some things are overlapping and they're the same. But so what is it like to operate a hospital in a rural community?
Absolutely. Well, it's no different than any other rural community. We face many of the same opportunities when it comes to recruitment, retention, trying to get specialty services and things like that. But fortunately, we've been able to address a lot of those with our phenomenal team, either through telemedicine or through recruitment efforts that we've had, and our partnerships with the college, for example.
Mhm.
We get many of our nurses from Wayne Community College. So those partnerships have helped, and we've branched out to a couple of other schools as well. But that's how we try to mitigate and address those challenges. But they're not unique to Wayne County. Many of our other hospitals and the other hospitals in the other systems, quite frankly, face many of the same challenges. And as many of our communities are not growing, and as parts of the state are and parts of the state aren't, we have to make it more attractive. And so we are very, purposeful about trying to find folks who want to live in our community, who want to stay in our community. And one thing I often say to physicians that are interested, I said, you don't have to sit in traffic for an hour.
Yeah.
That is true.
So that's one of the draws. And so we have a number of strategies that we've put into place and continually evolving to make sure that we're prepared to address any challenges that we face as a rural hospital.
Well, and on that workforce side, do you see it getting worse or getting better? Like, I mean, for some sectors of the economy, I know right now it's awful. You know, and it has been awful really since COVID. But I wonder if from you all side, where you have skilled labor, you have these sort of pipelines, are they looking for smaller places to live? Are they looking to be in more rural locations? I mean, I guess what's the trend?
Well, younger people want to be in the city.
Yeah.
that's generally what I'm hearing, whether they're physicians, technicians, or other members of our team or potential members of our team, I'll say that. But we're, again, very purposeful about what we do. So many of our efforts when we reach out to schools is, to introduce children to the health professions at a very early age. And one of the things I not so much hear, but in other positions when I've talked to young kids, like in kindergarten, I'll say, look, I'm a doctor, but I'm not a physician. Do you know what I do? And they're like, oh, you're a dentist. No, close, but no, I'm not a dentist. But there are a number of things that you can do.
But you do have great teeth. You know what I'm saying? You got great teeth.
Thank the Army dentist for that.
Yes.
So, but no, just making sure that all of our kids at the very youngest of ages understands what they can do in a hospital. It's not all doctors and nurses and technicians. We have a chef in the hospital. We have engineers in the hospital. We have a police chief in the hospital. We have a police force at the hospital. So it's like a little mini base or a mini city. So,
and, going back to the skilled labor and, the younger people's desire to live in more, urban areas. We have recently just launched something to kind of help make our hospital a little more attractive. We have this Vizient nurse residency program. So I don't know if
say that again. It's the what?
It's the Vizient nurse residency program.
Okay.
So what it is if you're a new nurse, newly graduated, you go into the hospital setting and you maybe get typically, a month or two of onboarding. Well, our program, you're going to get 12 months of basically, we're going to support you through that 12 months. You're partnered with an experienced RN. They are going to work with you individually. You also work in group settings. So we're developing programs like that where we're layering on the support. We have a lot of great benefits in terms of attracting people with health insurance and competitive pay, and we do all of those things. So we're trying to look at what is that next step, what else can we layer on top of it to make it more attractive to come to our hospital. So
also, I definitely, certainly workforce is a huge issue, and we can get more into that here in a second. But I would think that some other challenges with rural care might be access.
Yes,
from the consumer and patient side. Is that fair? Or
absolutely.
That is
education,
true.
maybe.
That is true.
Take me through maybe that problem, because I don't know that I didn't fully understand that or appreciate that problem, and I know a lot of people in the community may not.
That is true. And I've worked academic medical centers, I've worked quaternary facilities, I've worked teaching hospitals, I've worked community hospitals, and so forth. And it is a bit of a challenge here in rural communities compared to urban areas. It is. And access is a challenge for us. So primary care is one of the things that we focused on. We have a phenomenal physician recruiter. Dylan Black is his name. Just does a great job for us. He's hired over 20 physicians for us in the past 2 years, and continues to recruit. I got a text from him yesterday that we have a new anesthesiologist that's coming on board. So good news about that. And he's doing a phenomenal job of that. But we've also opened up some virtual options. So if you have my chart, which is our electronic record where you can access all of your lab results and get notifications for your appointments, sometimes even chat with your providers. There's a way to do a virtual visit. So if it's not something serious and you don't need to go to the emergency department and you just wonder, do I have pink eye?
Yeah.
My throat's been a little sore.
Wait, pink eye's not serious.
Well, it's infectious, but yes. Yeah. And I'm not
somebody
a physician,
somebody needs to tell my daughter.
I'm not that kind of doctor, yes. But
that it's not that serious.
It's not that serious.
Sorry, go ahead.
Yes, absolutely. But that's a true example. Actually, you could use the MyChart virtual option
with her
to have that.
See?
Or you have a rash on your skin. You're like, I don't
this
know
is
what
on
this
factual files.
Yes, absolutely.
No such thing. I'm sorry. Go ahead.
Yeah.
That's good.
No, and a lot of it is transportation in rural areas.
Right.
There's not like a subway system here. There's not,
Sure.
a lot of bus routes. So we have focused a lot on mobile outreach.
Okay.
So our foundation, the Wayne Memorial Hospital Foundation, they have been working with us on, we have a program called Connections. And basically, after you're discharged, you are partnered with a paramedic essentially. And they come to your house once a week for 4 weeks and they make sure you understand your medications, what's happening with your care afterwards. So we are trying to bring the healthcare to people because we understand that transportation is a major barrier in rural areas. So between that, we also have our watch program that Jessie had mentioned earlier. They go out in the community Monday through Thursdays at various locations. And it's a mobile unit that they go out and they are fully equipped to manage people's healthcare. And that is actually, all of these are free services. So watch is for uninsured. Our Connections program, that is absolutely free, that they go into your home and work with you. And something that we haven't officially launched or talked about yet is the Wayne Memorial Hospital Foundation is focusing on a diabetes outreach program.
Okay.
So that is something to look forward to that will be coming up because diabetes is one of our major areas of focus because rural populations, one of the other challenges that we have is with health disparities. There's a lot of chronic illness in rural areas and diabetes is one of Wayne County's.
Well, yeah, I want to talk about that some because, when you talk about disparities, it's not just, city and rural, but it's also among class and race. If you follow these data lines you see, it's pretty clear. And I don't know if maybe is part of that around trust or maybe intimidation around affordability because it is very expensive. Right. Or it feels like when you don't have a lot and you need care, you're going to wait until you absolutely have to have it, right? And that becomes a real problem.
Oh, yeah.
Well, it's multifactorial. So to your point about the differences between different patients and their outcomes, we focus on the data and look at the outcomes. Why is one group of patients having a different outcome from the same group of patients that are seeing the same providers? Oftentimes, it's what we refer to as the social determinants of health. Like Kimberly mentioned before, transportation challenges, food insecurities, not understanding how to navigate the system. Health literacy is a challenge. And so
shelter. Yeah.
Exactly.
Housing.
So we have a number of nurse navigators. And for example, in stroke, in
what is a nurse navigator?
They help to guide the patient. So you're diagnosed with cancer.
Okay.
And our stroke navigator will help you get to understand your primary care appointments, understand any interventions that you have to have in the hospital. If you have to have any procedures or any type of medications that you're taking, it's almost like a guide.
And they go with you to the appointments. So we are really looking to educate the patient from the moment of diagnosis and they stay with you through treatment. So, Marquita is our oncology nurse navigator. You get a diagnosis of cancer. We call up Marquita. She comes out to you and she says, okay, here are our next steps. And they're a great support group for the family as well, because something like that is really impactful. And we want to make sure everyone has the understanding and the tools. And we are trying to minimize those, what we call the social determinants of health.
And I guess, referral would also be a challenge.
Oh, yeah.
Where, I've just had the assumption that everybody in healthcare knew one another.
Oh no!
If you're the hospital, you know everything.
It would be great.
Know everybody. But as it turns out, it's just like any other business sector. This one doesn't always know what this one and this one and this one and this one and this one is doing.
Right.
And it would be beneficial, perhaps, to have those networks really well established, but they're not always well established. So almost anything that can happen to improve those referral networks actually improves health.
Right.
Yes.
Well, we have a formal program for that, actually.
Yeah.
It's called outreach. And so our physicians, for example, the physicians in our surgery practice will go meet with physicians in the primary care practice to explain to them what they do, what types of procedures they do, what types of patients you can refer to us, and establish that working relationship, because that's how it happens.
Yeah.
It's not driven by the hospital. It's not driven by the clinic. It's driven by the individual physicians that talk to each other. And so do that formal physician outreach program in all of our clinics.
And you participate in a rural healthcare summit. You know,
that is correct. That is correct.
We love the Rural Healthcare Summit.
And the crew there.
To build those referrals. Sorry, that's a shameless plug. You know what I mean?
Yes, absolutely. Absolutely.
But I guess recruitment, retention, reputation, and referral. When I think about that, seems like the 4 R's of like really serious challenges that may exist. And I'm sure it exists for every hospital in different ways, but certainly being in Wayne County, I think it's important for people to know that like just because you got a lot of smart people doing really great things, there are things that are outside of our control and outside of your control.
Oh, yeah.
That are affecting outcomes, right?
Absolutely.
That is correct.
Yes.
It's just like the school system. I mean, everybody wants to point and blame the school system for everything that's happening in the school system. But the truth is, a lot of what has happened to affect their outcomes happened without them.
Right. Oh, yeah. Probably 15 years ago, if I remember the date correctly, Robert Wood Johnson Foundation published a study that suggested that only 15, at best 20% of our healthcare outcomes are determined by healthcare organizations. The other 80+% is determined by our decisions. And whether we adhere to the instructions that we're given when we discharge, whether we understand those instructions, or able to get to our appointments, all those different things.
So, for example, the bacon cheeseburger that I ate today for lunch, which was delicious, by the way, I got to say. You're saying that's probably not wise.
Well, I'll tell you what Dr. Kudapat tells me.
Okay.
Jessie, it's okay in moderation.
Oh.
Yes.
Okay, but eat more green. That's my doctor tells me.
That's what my coworkers tell me,
Yeah.
too. Scott, you should eat more green.
Sport Durst Volkswagen Mazda of Goldsboro is proud to support Wayne County Chamber of Commerce. Family owned and operated, Sport Durst knows the importance of keeping local money local and supporting the community. We put our customers first with the area's best pricing, best trade-in value, and best selection of new and pre-owned vehicles. Come experience the Sport Durst difference, where customers and community come first.
It's pivotal work to be in this part of the world and be bringing care and trying to deliver the best care possible, to the various communities, that make up the whole, that make up the whole of Wayne County. And are you, I guess you're kind of a regional, like you're more than really Wayne County, right?
We are. We get referrals from other hospitals around us, even some of the UNC hospitals and even non-UNC hospitals.
Yes.
So we are kind of the eastern hub, if you will, for UNC Health.
So random, how did it go from Wayne Memorial Hospital to UNC Health Wayne? Like, what happened?
It's been a journey.
Yes, it's been a journey.
Yeah, explain that, because
we are still officially Wayne Memorial
Yes,
Hospital.
that is our legal name.
But the entity that is UNC Health includes Wayne Memorial Hospital, includes the foundation, and it includes Watch. And we also have a separate entity for managing clinics, but we no longer manage clinics. We have handed that off to the UNC Physician Network. But the entity that oversees all of that is UNC Health Wayne, and our partnership and connection to the system. And that's who we are. So Wayne Memorial Hospital is only one part of it. And as I mentioned before, and Kimberly talked about our Watch bus, that doesn't happen in the hospital. That's not a part of the hospital. That's an outpatient clinic. It's during the day, Monday through Friday, most Monday through Fridays, not on weekends, not on holidays and so forth. But that's not hospital. That's actually outpatient in the community, but it's still a part of UNC Health Wayne.
The network of service that's being provided, I guess.
That is correct. It's the system. It's the entire system. Wayne Memorial Hospital is only one part of it.
Okay, so then does your board and your staff, you make decisions about all of those things or some of those things?
All of those things, with the exception of the UNCP and Physician Network clinics. That's a separate entity.
A whole separate deal.
So, and they're statewide.
That's right. And I'm guessing that's like a third party arrangement or no? Do you know?
How do you mean?
Well, in other words, like, are you? I don't know. What is that arrangement? Because I assume. At first I thought, I'm gonna be honest with you, I thought that you hired everybody. I thought that all the doctors and all the people and all the stuff that they just work for you. But as I've gotten more educated, I realized that it's a collection of relationships with vendors or third parties.
That is correct. Now, some of the we have independent physicians in the community that don't work. They work on their own. They're independent physicians, and they practice themselves. They have privileges to admit to the hospital. They have privileges to work in the hospital, but they're their own. They don't work for us.
They're self-employed.
They are self-employed.
Okay.
Absolutely. Then we have UNC Physician Network physicians. Again, don't work for the hospital, but they work for the UNCPN. And so they have privileges at the hospital as well. So really, doctors don't work for the hospispital.
Yes. So the clinics that are out in the community, those are UNCPN.
I see.
Yes.
I see. See, we're learning. We're all growing.
Yeah,
we're all growing.
It's complex.
I'm sure everybody else in the world knew that. Assume I'm the last to know.
No, not really.
But that is so interesting. Yes. And
it's different from like when I was in the Army. All the physicians were employees. Some of them were civil service employees, but some of them wore the uniform, but they were all employees.
Yeah.
It's not like that in the private sector.
Yeah. And, we partner with UNCPN to get physicians to our area, right? So that's where Dylan Black comes into play.
Yes.
So he serves as like the bridge, essentially, from UNCPN to UNC Health Wayne, right? So we work together on getting the physicians here, seeing what physicians we need, what specialties we need to grow, and that's how that relationship goes.
Interesting.
And we also invest in the clinics.
Yes.
So if the clinics, are unable to be self-sustaining, which is not unusual. Many communities have that same situation. The hospital helps to cover that to make sure that we have the care that's needed in our community. So many of our specialists are here because the hospital is helping with that investment of keeping those clinics open.
That sparks another question that's business related.
Okay.
And you may, I'll just ask it. It's still a business.
That is correct.
So at the end of the day, I would imagine there's also a major balance trying to be struck between care,
yes,
and business. I mean, how do you navigate that? I would imagine that's probably the hardest one.
It is, but I'll quote my mentor, Dr. West, who's now retired. She would always say, and she would always start it this way: unfortunately, healthcare is a business, but it's our job to make it a compassionate one. Mm-hmm. And whether it's for-profit healthcare or not-for-profit healthcare, county healthcare, no matter where it is, there's a business. You have to cover your expenses.
That's right.
And so, but I've also, have a true north, and I tell every teammate that we have in our new teammate orientation, and every new physician that's interested in coming to our community. I had a physician I interviewed yesterday. She says, "What do you expect from me?" I said, "Well, I expect for you to treat everyone that you encounter as you would the most treasured members of your life." Mm-hmm. So every decision I make in the hospital, regardless of the business implications, that's where I start.
Yeah, that's
and
right.
So, but we got a fabulous team. We got a fabulous CFO, CNO, Chief Medical Officer, Kimberly, of course, Marketing Communications. We've got a fabulous team. Mm-hmm. I get all of that information, but my true north at the end of the day is what would I want for my son, my daughter, my mother, my father, and my mother. So
right, because I guess the worst business decision you could make is to not prioritize care.
Oh, yes.
Right. I mean, at the end of the day.
When you say prioritize,
I just mean that you're
set that as a priority.
Yeah,
yes.
Okay.
That's what I mean. Like you're
absolutely
spot on.
I mean, that's our driver of all decisions.
Your mission is help.
Mm-hmm.
Absolutely. To have people healthy and be good and be okay.
Yes.
So
Absolutely.
all I'm saying is that if you any decision, I guess it would be motivation from a business. I'm trying to think about it from the business standpoint, right? Mm-hmm. That even from a business standpoint, if you deliver less of that most important thing, you become less valuable to the person that you're trying to do business with.
Well, and from a strategic standpoint, like Jessie was talking about, we prioritize patients, right? So we start with, okay, how are we going to meet patient needs? And then we kind of work backwards into the business aspect of it.
How are we going to get it paid for? Right?
Exactly.
Right.
Like, here's what we need. Let's make it happen. How does it happen? Right. So we really kind of take that approach because we live in the community.
The mission leads the money.
Exactly.
Yes.
Instead of the money leading the mission.
As the Sisters of Charity would say, no mission, no margin.
Yes.
That's right.
Yes. And
No
Jessie
mission.
and the team has done a great job with balancing that, making making sure that the patient is at the center of all those decisions, because it is a challenge. It's a business, but we're here for the community.
That's good.
That's also the beauty of not-for-profit healthcare.
Yes.
I've never worked for-profit healthcare, but we do have for-profit hospitals around the country. And I'm not saying they're not good hospitals, but they have an additional pressure of having to pay taxes. They have to pay shareholders. Many of their teammates are shareholders of the organization, and they've got to have a return on that investment, and their margins must be much larger. We just have to cover our expenses, have enough to repair the roof and fix the elevator, and then have a little money for a rainy day. And that's, we're doing quite well in that respect.
And then to make sure people know about you. So I think sometimes people would ask, well, why marketing? Why do you need to market? But the truth is people need to, as much as we assume that people just know, they don't know.
No.
So you being present in the community and communicated out in the community is really a crucial task of all these things we're just saying too, right?
Yeah, I mean, because we do have a lot of great programs going on, and we talked about some of them, but they're not helpful if people don't know about them. I mean, there's free programs. We just last week had our outpatient nutritionist in the grocery store shopping with people, showing them, here's what you can eat with your dietary restrictions, here's what you stay away from, here's how you read a food label. We're doing all of these things, but we need people to know about them because we're trying to close that gap in, the education or whatever it may be. So yeah, we definitely need to market and be out there.
You also just donated defibrillators to the Boys and Girls Club.
Oh, yeah, we did. Yes. Yeah, that was great. Yeah, we were happy to do that.
Those little, it seems like a little thing, but it's just over and over again, you guys being in that narrative is just, it makes us better.
Yes.
Like it doesn't just make you better, it makes the county better. It makes the community better because people know about you. They know that you're there, and they do recognize that mission is the priority, right? The health is priority. So I'll ask you a more, maybe a little bit more challenging question, maybe not. But you guys have recently made a series of decisions that may need a little clarification. And I wanted to maybe give you some time to, I guess, let's talk that through. Can we?
Oh, yes, absolutely.
I'll start. Let's talk about the ED stuff.
Yes.
Okay.
And I'll let you.
Absolutely. Well, I guess back in December, we partnered with a new group called WEPA, Wake Emergency Medicine Physicians. And they started working in the ED, I think December 20th was their first day. And so we made some changes there because one of the biggest complaints that we had as a hospital in terms of our image was wait time in the emergency department. Not uncommon from other hospitals. And I don't know of anyone who says they loved the wait time in their emergency department. As CEOs around the country, we're all concerned about that. And so that change was made in December as a result of some opportunities that we saw that we needed to make. And so made that change. And since then, I'm happy to report that things have gone very well. Our patient satisfaction scores are the highest they've been in 6 years. Actually, I say 6 years, but we can't find any data older than that. So it could be longer than that, but at least 6 years. Our wait times are down, and our volume continues to rise, slowly but rising.
So let's talk about wait times just a second, because I would think probably almost everybody in the community, the people that are consuming what you do, that is probably an area that they are somewhat familiar with, the exposure to that area of your organization. And it's always been the thing that I've heard. So talk to me, what was the wait time on average? What is it now? Do you guys know? Is that I'm guessing that's being tracked and all that?
Oh, absolutely.
Yes.
That's actually a metric that we review every single month. And we have actually in our organizational goals, which are, how Kimberly and I have
organized your work.
Our evaluations are based on that.
Yes.
That's, I made that decision last year, I think it was, to make our organizational goals. This is one of our organizational goals, to ensure that wait times are not high. So we're evaluated. All of our leaders in the hospital, that's a part of our evaluation in terms of the wait time. And then, of course, with our partnership with WEPA, that's a part of our arrangement as well, to make sure that our wait times are reasonable. And so, we track that every single month, and we've seen just a marked and significant reduction in that wait time. And a part of it is because I think just the approach to how care is provided. We didn't add any staff, and we've actually reduced the number of staff members we've had in the ED. Before December, we had probably 30 extra staff members that we had in the ED than we had the year before. Now we're down to about 20. So probably fewer staff members in there, but that doesn't mean that we have reduced the quality of care. Patients are just moving so much faster. We don't need as many staff members. Haven't let anyone go. That just means that folks are not working as much overtime, and that we don't need as many travelers, and we don't need as many PRN. My focus is again to improve our outcomes, improve the wait time, and what I would expect from my loved ones is what I expect for everyone in this community.
Yeah.
So,
did you want to add something to that? It sounded like you wanted to.
No, he said it perfectly.
Okay, said it perfectly.
Yeah, no, yes.
I should have let you go first.
No, he's.
What is she gonna say?
No. Goodness, yes. And I think that there's also to this, because I get this question sometimes in the community too about the ED. Well, I was first, and then someone went back before me. Well, it's based on acuity.
Yes. Right.
So if you come in with a sprained ankle and then I come in with chest pain, an hour later, you may be sitting in the back a little longer, because there's two parts to that process. You see a triage nurse who basically determines the severity of your situation, and then you see a provider after that. And things like chest pain, things like heart attacks, things like gunshot wounds, any type of trauma, motor vehicle accidents, that will tend to slow things down. And so if you hear overhead that there's a code that's paged, that means we have an emergency situation, and folks are going to concentrate on that particular patient to make sure that they have the best outcome possible. Right. And that may produce a bit of a delay. But we have nurse practitioners, we have PAs, and we have physicians in the ED, which we've always had, those three. But we have not made any significant changes until we opened the vertical flow unit, which opened last week. I think it was last Tuesday.
Officially
opened. Yes, we were waiting for clearance from the state. I know their inspectors are so busy, and they're going all over the state trying to inspect.
So just make sure I heard that right. The vertical flow unit.
Vertical flow.
Yes,
unit. Yes,
we are excited about it.
That's exciting, right?
It's almost like an urgent.
I just like saying it out loud. Vertical flow unit. So what does that mean? What does that do? Yes. How does that serve the interest?
Well, most of our patients, about 85%, are not admitted to the hospital. So when they come to the emergency department, they're treated and discharged. So we've designed an area that basically is like an urgent care center. Mm-hmm. So you'll come in, you'll get your tests. We have rapid testing there. We have point of care testing, rather is probably a better appropriate way to say it. And then we also have expedited results. To make sure that we can get folks in and out faster. Mm-hmm. So basically, and it's called vertical flow because we're not putting you in a bed. Right. We're actually putting you in a chair or recliner, which is a bit more comfortable, but it also,
it's more temporary too.
It is. Yeah. Absolutely.
Well, and like Jessie said, it functions as almost like an urgent care, right? So when you have you coming in with your sprained wrist versus Jessie coming in with chest pain, he's going to be managed by, the main ED area where you're going to be treated in that vertical treatment center, so it expedites care in that respect. So we're excited to see the results of that.
Right. I guess it would expedite care for the less serious
exactly.
things. Is that right?
That's correct. And all the improvements in patient satisfaction that I mentioned occurred before we even opened that.
Mm-hmm. Yes.
So we're waiting to see what that's going to do to further improve our outcomes.
Yeah.
Yes.
Wow.
Exactly.
And so I get our PAs and nurse practitioners. Is that where I guess you would see? Explain that to me. Like how does it get determined? This is just because I'm curious. How does it get determined who cares for what?
Right.
Maybe that's the best way to ask that question.
Yeah, it's usually through triage.
Yeah, right. When you come in, you're triaged.
The higher acuity will go to the physician.
Yeah.
The highest level of acuity. But now we do have specialists, PAs and nurse practitioners that are specialists. So we have surgical PAs, orthopedic PAs, and things like that, and nurse practitioners. And so they have their individual specialties, and they work up to what's called their scope of practice. So each state has a practice act for what they can do within the scope of practice and what a physician has to supervise and what they can do independently. And so they're able to work, as we say, to the top of their license in places like our emergency department and surgery and other places, and our clinics as well. Mm-hmm. So we have them in our clinics too.
That's amazing. And
and that helps with rural healthcare as well.
Right.
With recruitment, because it's much more difficult to get a physician to rural communities, but nurse practitioners and PAs are often more willing. And if physicians are willing to supervise them, like, shout out to Dr. West, one of our great doctors in the primary care clinic. He has a group of, we call them APPs that work for him, nurse practitioners and PAs, and they just do a fabulous job for us.
So, So from a recruitment standpoint, I think that's why it's such an interesting question is that you need them all.
Yes, we do.
Mm-hmm. We need them all. Yeah, Wayne County would benefit, and
it takes a village.
Yeah, and anything that any added capacity we have, it speeds up care. improves care.
Yes.
So, it's better and it's quicker.
Yes.
That is correct.
Which theoretically would also make it more affordable.
Don't
answer that.
Healthcare in the United States is a business.
Yeah,
And I think many of the changes that you've seen in terms of even over the past couple of years, like I said, I've been in healthcare for over 3 decades, and we've been trying to bend that cost curve for years.
Yeah.
And ultimately, a lot of decisions and efforts that you see go into that are trying to make healthcare more affordable and make it more accessible. But it is expensive.
It is, yeah. And a lot of it's dictated by insurance companies, which is another educational piece that, not many people are aware of. What role does insurance play in the financial aspect of the bills that we get as patients? And, because we're patients as well. Like we see these things too.
Sure.
So yeah, it's a complex thing, the insurance. So that plays a major role in that, in the affordability of it. But, recently with the Medicaid expansion, that I'm hoping to see some great results from that. And I can't remember how recently it was passed, but we had in the works basically a Medicaid enrollment program ready to go for when Medicaid was expanded, and another free program that the hospital is offering the community. We are going to come to your house and enroll you in Medicaid. So it's our Medicaid enrollment program, free. We have our insurance specialists come and walk you through the process, so that way we can get as many people enrolled in insurance as possible.
Outstanding. So let's talk about the second area of focus that seems to have gained some attention, and that is on your pediatric care.
Yes, absolutely.
So maybe explain to us the situation and the decision that was made, and what the outcome is.
Absolutely. Like we used to say in the Army, bottom line up front, nothing has changed. Okay. So, and I'll explain what I mean by that. And I will say this too. We never take a decision lightly. And, Kimberly and I both have small children. And so, we thought about this decision before it was made, but if I don't have physicians, I can't run an inpatient pediatric unit. So that's ultimately where we are. And so the other part of this is patients who used to be admitted upstairs. There were about maybe 1 patient per day on average is what we would see. And they would stay in the hospital anywhere from 18 to 36 hours, which is really observation, not truly inpatient. And the difference between the two is, of course, inpatient usually 4, 5, 6 days, sometimes even longer. And, we have some patients that spend months with us because we're not going to kick someone out on the street if they don't have a safe discharge. So, but those patients, 18 to 36 hours. And so what we've done is now those same children are being taken care of in the ED. So every child that we used to take care of on that unit can still be seen in our emergency department by our emergency medicine physicians. And quite frankly, it actually expedites their care, because if we do find out that they need emergency surgery for a surgical pediatric specialty that we don't have, then we can transfer them more quickly from the ED, because the helipad is right outside the door, and ED to ED transfers are a lot faster. So it will actually expedite that care. So you should never try to drive to another hospital. Come to the emergency department.
Yes.
If you have they are trained in their residency, and they are board certified as physicians, or board eligible if they're coming in right out of training as a physician, to care for everyone from birth to death. And that's what they're trained to do. And so there really is no change in that respect. We are drilling down a bit on some of our surgeries in terms of what we'll do in the future. But at this point, that has not changed. And so if you have a concern about your child, bring them to the emergency department.
Yes.
Bring them to do not try to drive to Raleigh or wherever else that you think you need to go. Come to our emergency department. That's the best place to go. And that's where I bring my son, and that's ultimately how we should do that.
And another piece of context that I think would help with understanding the situation, the decision, is the healthcare trends, right? So parents are a lot more proactive than they used to be in terms of their children's healthcare. And also pediatricians' offices are doing a lot more, right?
Yes.
So they've expanded their capabilities. So what you used to have to come to the hospital for, like a breathing treatment or, fluids, is something that they're able to address in office. So with them addressing those needs in office, there's not much of a need anymore for them to be hospitalized.
And that's a nationwide trend.
Yes.
It's not just here.
Right.
Hospitalizations have been falling, and only children's hospitals and children's specialty hospitals have been growing.
Yes.
Mm-hmm.
So
I'm tracking. I'm tracking, I think, I mean, it just seems like the demand, what I think I'm hearing you say is that the demand for hospitalization was much lower than justified
Yes.
a focused area for it. Is that?
That's a great summary.
From a real estate standpoint, as far as inside the hospital.
Well, no, it really had nothing to do with that. I mean, because we really only had 3 beds designated.
Okay.
And we usually filled one, and most days it was empty.
Yeah.
Right.
So, but that really wasn't the decision. The decision was what's best for children and how do we get them treated faster?
Mm-hmm.
Because before you'd come to the ED, you'd wait for however long that was, then you get admitted upstairs or put an observation upstairs, 18 hours from there, then you're going home. After you get fluids or whatever it is that you didn't, have before coming in. Now you're treated in the ED and discharged.
Immediately go.
Right.
Yeah, as soon as you're well enough for discharge, you're discharged. And really, our practice has always been, treat the patient well enough until they're being discharged, right? So right now, that's just taking place in our emergency department. Before, you would go up to a floor, right? So the only thing that we have taken out is the elevator ride upstairs.
Yeah, well, that's a crucial way to say it.
I mean, that's really the only thing that is missing. Because before, if there was a higher level of care needed, let's say a pediatric surgery or something that we didn't do, we want to send them to the specialist. We want to send them to where they're going to get the best care. So those patients were always transferred out. They continue to be to this day. And really, the only thing that we took that is missing is the elevator ride. You're just staying in the emergency department in a room. You're not sitting in the waiting room. It's nothing like that. You actually are in a room in the emergency department.
Those were great explanations.
Okay, good.
And if there are questions, we ask that folks call us.
Oh, absolutely. Yes.
Don't believe everything you hear.
That's
okay.
Right.
Call us.
Oh, Lord.
Call us.
People are going to believe everything they hear. It could be the dumbest believe everything they hear, and they're going to believe it.
For everything. I get it.
I'm amazed at what people believe.
Please don't hesitate to call us. Please don't
hesitate. No, we are really interested in talking and interacting with the community. That is something that I have tried to focus a lot of, my department's efforts on, because we do have a lot of great things going on. We're a 4-star hospital. We have 5 Leapfrog A's, which I'm not sure if you're familiar with what that means, but basically it's our quality. It's great.
Yes.
It's our quality and our safety, right? So we're being nationally recognized for, our treatment of chest pain, COPD, which is breathing issues, our maternity services. Like, we have national recognitions in these areas. And we want to talk to the community. We want to know how we can help you better. We want to know what are your concerns so we can address them, because with the announcement of our change of pediatrics, we're in a day-to-day. So we understand operationally what that means, that we're just taking out the elevator ride. And to a parent, we can understand that, oh my goodness, what does this mean for me? And we want to tell you what that means for you. We want to have those conversations. So we definitely encourage questions, anyone to reach out at any time. My contact information is always available on the website, and we want people to know what is available to them.
Yeah, that's great. So let's talk about the future. Future of healthcare, future of rural healthcare in particular, future of this hospital in Wayne County.
Yes.
It looks like what?
Growth.
Great.
Yeah.
Yes.
Great growth.
We are excited.
More.
Yeah, we have a lot of great stuff coming up.
So one thing that we've done, and I think when I first arrived, I guess 3.25 years ago, I did a presentation to the community, and I forget where it was. Was it Lane Tree? I think
it was Lane Tree.
Yes. And so I did a presentation to the community, and if you remember, there were 3 parts of that. It was one part of that presentation where I laid out what I'd call my vision for the hospital for the future. The first part was to identify opportunities for improvement. We've got a great hospital, but there's some things that we can improve on, a great system, if you look at the entire system, that we can improve on. And so my first goal was to identify those areas to improve, and many of them were already in motion. Dr. Filippo, our chief medical officer, who I call him affectionately Coach Filippo because he calls the plays and we just run them. Mm-hmm. So, but a lot of that was already in motion. But then, of course, basically putting all the recipe together to improve and produce those outcomes that Kimberly mentioned, the Leapfrog A's and CMS Star Score. That's basically says that we've got the highest patient safety and the highest quality of care in Eastern North Carolina. Of 25 hospitals in Eastern North Carolina, there are only 2 others that have scores that are like ours.
Mhm.
That's ECU Duplin, which is about a 50-bed hospital, and Novant Brunswick, which is about a 70-bed hospital. We are an over 200-bed hospital, and so we're the largest hospital in Eastern North Carolina with those high patient safety and quality scores. And so my next step, as I mentioned in that presentation, was to tell the story, and that's where Kimberly comes in. The marketing communication. You see the stars and the billboards that we have. We've got robotics. We bought a second robot.
Yes.
Dr. Sargent just completed his 1,000th robotics case. So we remember about maybe 8 or 9 months ago, I think Dr. Remington had completed his 1,000th case, and Dr. Sargent was at 500. Now he's at 1,000. So with exceptional outcomes. So bought a second robot, and that's another part of that growth. So what we're trying to do now is to, as Kimberly does very well, tell that story. And say, come on back home. It's all those folks who were bypassing us, going other places because they didn't want to wait.
Mm-hmm.
They couldn't get an appointment. They had a bad experience. Again, not just the ED patient satisfaction scores have gone up. Our inpatient scores have gone up as well. Not quite as much as the ED has, but the inpatient scores are up as well. So now we've got that story to tell. So the future is growth. I want folks to stop bypassing us and come to our hospital now. And we're starting to see that already.
Yeah.
We're already starting to see that.
Yeah. And I think sometimes it is narrative based.
Yes.
People believe the story they've heard.
Yes.
Right.
Whatever that is. And that's what drives their decision about where they're going to be. So you could be doing, like you just said, the best thing ever in the world.
Right.
Mm-hmm.
But if people haven't heard it and people don't know it,
Right.
then they're still not going to be participants.
Yeah. And that's been one of the major challenges in my role specifically is changing that narrative. I know for a long time, the community has had a certain perspective of the hospital, but we're different now. For the first time in the history of the hospital, we have those 4 stars. We have these leapfrog A's. That's never happened before. We are delivering such an enhanced quality of care. Jessie and the executive team have such a focus on quality and patient safety, and we're seeing it in the data. And we get to look at the data all the time, but the community doesn't, right? I mean, why would they? So that's one of my challenges is getting that out there and letting them know, like, we have great things here for you.
Yeah, and I always think it's a big challenge for every organization in business is, a lot of people are doing great things, but we always, I'll never forget Mayor Charles Gaylor, mayor now.
Yes.
But a friend, and when I was first thinking about going into business, he said something to me that because he used to work for Small Business Center.
Oh, yes,
I'll never forget this.
Over
He
the
said,
college, yes.
over the college.
Yes.
And he said, every person that's going into business or every person that's in business always underestimates what it takes to market their good or service.
Mm-hmm.
The assumption is that everybody knows.
Yes.
Or more people know than actually know. There's 110,000 people, 112,000 people that live in Wayne County. I don't know how many people live in the 7 or 8 county region around us, but it's a lot of folks.
Yes.
So, you figure even if half of those folks know, that means a whole lot of people still don't.
Mm-hmm.
And I would just think that that's a challenge that's going to continue to be a challenge.
It is.
But it's a lot easier to do that job, I would think, when you have something good to say.
Oh, yeah. I have a great platform to do it from. I just need to make sure I'm reaching the people, because there are people who are 10 years ago may have had a negative experience and they say, I'm never going back there.
Yeah.
No, come on back. Like we have got things going. So, yeah.
No, I think that's fantastic. And I know our experience has been tip top. I mean, our experience has been A+. I mean, we had our third child was there. I've been in the ED. My wife has been in the ED. My children have been through the ED. I've visited patients who were there, inpatient care, and you talk to all of them, and almost every single one of them say the same thing. It was a great experience.
Okay, good.
I was treated so well, because sometimes people they're willing to forgive certain things. But the thing that sticks with people, the impression that they have is just the way they're treated.
Yes.
So when you said that part where the doctor and to treat them like your most treasured person,
Most important person in your life. Absolutely.
That
If
comes
you start
through.
there.
That's right. That comes through, right?
And
You
I
can't
just
go
can't
wrong.
stress how genuine that is. He says this at every meeting, every orientation. Like that is a central focus and theme throughout the hospital that is communicated throughout the floors. So I really want to stress the genuine sentiment behind that.
Yeah, I think that's my true north. I mean, and Kimberly's been with me through some tough decisions. So if I don't know what to do, I always pause and say, okay, what would I want for my loved ones?
That's right. That's so true. What would I want for my loved ones? And that, and when that's the filter for a decision, business or otherwise, what a great matrix. Because it does get you, regardless of what people are going to say, it does get you to the right decision usually.
Amen.
And I think that's why it's important that even when people are being critical of a thing, it's important first to understand what has happened and the decision. But number two, understand that particularly if it's getting us to a better place, a more right place, you got to learn to just get over some things sometimes.
True.
So, and that's true for every organization. Change is hard.
Change is hard.
I don't care who you are.
No matter what. Yes. So true. So true.
And then you think, like I think about for the chamber or for, businesses, churches, anything, it's the same function. It's the same challenge that there are obvious things that have to occur.
Right.
And there are reasons, really good reasons why they haven't.
Right.
But status quo is not acceptable.
Right.
It's unsustainable. Yes.
It's unsustainable.
Yes.
Eventually, if those two things continue to carry on, the most vital things don't ever occur. The most valuable things don't ever occur. And so I just think it's a testament of leadership to say, hey, we have to do the right things for the right reasons. And then, and then just trust that just trust our decision, live with that decision because you know why you made it and how you made it. And so I admire very much. I think that you all are in one of the most difficult positions because you touch so many different people's lives in very tangible ways. Like, some people talk about that, but you guys are life and death, health and not health.
Yes.
People's families, their closest,
that is
most
constantly
treasured.
on my mind.
That's right.
I have to tell you. Yeah.
So I just
constantly on my mind.
I guess I admire the leadership that it takes to try to deliver that over and over and over with consistency and understanding. I think we talked about this earlier. I don't know if we did it here or somewhere else, but you can make 6 great decisions and on the 7th you mess up and all people are ever going to hear about is the 7th. You think about how many days in a row, how many decisions in a row, how many, whether it's a physician or a nurse or a person who is working security or in the cafeteria or in administration, how many good decisions are made over and over and over and over again at UNC Health Wayne, that whole network. All of the good that is occurring through the foundation, all of the good that is occurring through the Watch program. And you can make one mistake on a Sunday morning, and that's the only thing anybody's ever going to talk about. Isn't it crazy?
It is. But we learn from that, and we always try to take those as opportunities because, again, what would we want for our loved ones?
That's right.
That one time could be our loved one.
Yes.
And so, we've got to try to find a way. We know we're not going to be perfect, okay? But we have to have that as our vision.
So you're growing. Go ahead.
And I have to say, too, when you say about the future of our hospital, I have to say that you're going to see a lot more partnerships with the college. Dr. Pfeiffer and her team have just been phenomenal with us in terms of, to your point, of workforce development and the future. If we have folks in our community who don't have a way to pay for college, between me and Dr. Pfeiffer, and we might be able to help you. So
that's right.
Let us know and try to get.
If you want to be in a healthcare career,
exactly,
this is a good pathway.
An apprenticeship program, nursing programs, any of the technician programs. We have a number of different opportunities for folks, and so not having the resources to go to college should not be the barrier. Dr. Pfeiffer has a number. She has far more programs than we have, but we have opportunities where we provide scholarships as well. But we're constantly looking for ways to partner with Dr. Pfeiffer and her team, and she just has a phenomenal vision, I think, for education for our community that's going to serve us all very well.
And practical.
Absolutely.
Practical.
Right. And former airborne.
That's right.
I don't know if you knew that or not.
I did.
She used to jump out of planes.
She did.
at Fort
You
Liberty.
would definitely not know it when you first meet her. It would be a piece of party trivia.
Definitely jumped with the Army demonstration team. Actually,
she was
great.
Yes,
absolutely.
She's phenomenal.
Going back to the growth piece internally, our Vice President of HR, Doug Harrison, he's doing a lot of investment in our teammates, right? So they're developing a lot of programs where you can come in, they call it the clinical ladder program.
Yes.
So you come in as, let's say, a CNA, which is a nursing assistant. You can come, I believe, right out of high school.
Yes.
And you can work your way all the way up to be like a PA, an NP.
We have one that did that. Yes, nurse practitioner.
So, we are really invested in growing the talent that we have here. So in addition to our partnership with the college, we are looking to strengthen the workforce here, and we are putting those programs into place that need to make that happen. And also in terms of growth, we do want to be out in the community more. We want to strengthen our partnerships with the base. We work very closely with them, especially with our emergency management processes. That is something that we are definitely expanding upon. And we have a major focus in the hospital with security. Jessie has done a great job, and we have metal detectors at the front door, the emergency department. We do our drills regularly now. So there's a lot of exciting stuff going on there.
Yeah.
The additional security measures I can't mention. But we're not going to tell all of our secrets.
That's so exciting. Yes. That's what happens when you wear one of those name tags.
To keep everyone safe.
You know stuff behind the scenes.
Yes, absolutely.
Well, that is a lot to look forward to. And I just want to say on behalf of our community, thank you so much for what you do.
Thank you.
You guys, you keep us safe and healthy, and you just do a lot that you don't always get credit for, and your teammates don't always get credit.
That's what I'm saying. The thanks goes to the teammates, which includes our medical staff.
That's right.
And it takes that entire village, and they've just done a phenomenal job.
Mm-hmm.
All the credit goes to them.
And is there anybody in the world better than a nurse? I mean, I just wonder. It's sort of like teacher. I mean, there's just something about a nurse when you meet them. They're kind of, I don't know. They've seen it all.
I joke with Kimberly all the time. Nurses are like veterans.
Yeah, that's right. They're tough. Yeah. They're tough birds. Well, we love them all, and we're so appreciative of them all. And just thank you for being the huge community asset that you are. We could not be the community that we are without you. It's so much in our interest to see you succeed and to do well. And we notice that that's what you're doing. And so thank you for the choices and decisions you've made. Thank you to all of your staff and your team. And thank you for spending time with us today.
Thank you for having us.
Our pleasure.
Yeah, it's been fun.